Good afternoon, everyone. I am Catherine Brookman, Associate Director, Knowledge Transfer and Exchange, and on behalf of Dr. Jack Callahan, Director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, or CRE-MSD as we are more commonly known, we'd like to thank you for joining us today for this free webinar. A warm welcome to all of our community of practice client-patient handling members, as well as to the rest of you who have joined us on this wonderful hot summer day. We are grateful to the Ministry of Labor Training and Skills Development for our funding, which supports the delivery of these webinars, and to our presenters who provide their expertise. We ask that you keep yourself muted for the duration of the webinar as a courtesy to the presenters and all participants. The format of today's webinar is as follows. The presentation will be given, after which time we will have 10 to 15 minutes for a question and answer period with our presenter and her co-researcher. During the question and answer period, we ask that you type your questions into the chat box. The chat box can be pulled up on your screen by selecting the chat icon in the control panel that appears near the bottom of your screen. I will relay these questions to the presenter or a similar question should we have duplicate themes. Should you have a pressing question or an issue such as a technology glitch that cannot wait until the end of the presentation, please type this into the chat box and we will do our best to address it right away. The web will be recorded with the recording being made available to you on our CRE-MSD website along with the presenter slides shortly after today's webinar. You will also be sent a link to an evaluation. Please fill this evaluation out as it will assist us in the future delivery of our webinars. We have also added a new question that asks you for your preferred time for these webinars. Thank you so much for joining us today, and remember to watch the CRE-MSD website and the MSD Prevention website for new resources and events. Now it is my pleasure to introduce to you our presenter and her co-researcher. Ms. Daphne Ho is a Master's of Science student in the Occupational Biomechanics and Ergonomics lab at the University of Waterloo. Her research is focused on the use of wearable technologies as a tool to help monitor and reduce biomechanical exposure in the workplace. In addition, she is currently working closely with the personal support worker population in an effort to mitigate injury risk among these workers. I'd also like to highlight that Dr. Stephen Fisher, while not presenting with us today, is a co-researcher and on this project and available to answer questions as well. Dr. Stephen Fisher is an associate professor in the Department of Kinesiology and Health Sciences at the University of Waterloo. His current research focuses on developing and evaluating pre-post-hire physical employment tests for physically demanding professions, and on identifying how individual factors such as arm strength, length, affect movement behaviors when performing occupational tasks. Thank you for joining us, and over to you, Daphne.
Thank you so much for that introduction, and I will get right in. Ooh, there we go. All right, so as Catherine introduced, I'm Daphne, and I am a first-year master's student working in Dr. Steve Fisher's lab, the Occupational Biomechanics and Ergonomics lab at the University of Waterloo. And I'll be presenting some of the work and research that I've been working on since last summer. And this presentation will go over the development, distribution, and results of a survey that was aimed at identifying the critical physical demanding tasks of personal support workers, or more known as PSWs. As well, my presentation will delve into some implications that the results of this study can have on ergonomic interventions targeted at the PSW population. So imagine that your job is to provide care and support for an individual that has suffered from a stroke and now has limited mobility and requires some at-home care. Now, imagine working in an environment that looks something like this. The room is small and cramped. There isn't a lot of space to move, but you're still expected to take care of your client, perform transfers, and maneuver the client's wheelchair. You're the only worker sent to provide care, and there's no assistive devices provided for you. After providing care to this client, you have to quickly drive to your next client's home, where you have to take care of a client who's broken his leg. This client weighs around 250 pounds, he's 6'2", and he needs assistance with tasks such as bathing and dressing. And again, you're here by yourself with no assistance, and there's no assistive devices given. So these are just some of the scenarios that are often experienced by PSWs, along with several others, and speaks to how various, difficult, and physically demanding their jobs can be. So now that I've set up the scene a little, I wanted to clear up what the PSW role entails to people who might be unfamiliar and describe some trends amongst this worker population. The main goal of the for PSWs is to provide personal care to clients according to their care plan, and this can vary depending on the needs of the client. So personal care involves tasks such as bathing, feeding, moving and transferring the client, and assistance with medication. PSWs typically work either in community care, which involves going into client residences, as well as in facilities such as retirement homes. As well, PSWs can be assigned to actually work in both environments. In recent years, there has been an increasing demand for community care, which comes as a result of a rapidly aging population, associated shifts to at-home care in Canada, and overall decreases in hospital-centered care. PSWs do represent the largest percentage of the community care sector in Canada and are still growing as a result of the previously stated shifts, in addition to the COVID-19 pandemic. Now, why should we care specifically about the PSW population? Well, as a result of increased work and task physical demands, healthcare support workers, which includes PSWs, had one of the highest number of allowed lost time claims, with sprains and strains being one of the leading sources in 2020, right behind the COVID-19 infection. Now, not only is there a high work demand placed on PSWs, but the nature of the work completed is also highly dynamic, where PSW tasks can require large amounts of movement, but it can also be non-cyclic, where PSW tasks can vary greatly within a shift, as well as across shifts. Now, this makes it a really difficult job to perform classic ergonomic assessments on, and is not amenable to classic ergonomic interventions. In addition, increased difficulties are presented due to the varying environments PSWs must work in. So whether it's a cluttered client home like we saw previously, or a spacious retirement home. As well, the dynamic nature of their job is strongly affected by the varying clients that they need to see, due to features such as client height or weight and varying care needs. So as the PSW job is highly demanding, variable, and not amenable to classic ergonomic interventions, where do we go from here? How can we help lower the risk of injury amongst these workers? A possible idea would be creating a physical employment test to ensure that a potential new hire's physical abilities match the physical demand required of the job. Another idea could be to update PSW education programs and training, and highlighting areas where more attention should be directed towards in terms of teaching PSWs how to safely execute these high-risk tasks. Or perhaps a real-time workload management system to continuously and actively track a PSW's risk for injury. But before we can even start designing ergonomic interventions, we need to first understand what is it that PSWs actually do, and more importantly, what are the most frequently completed and most physically demanding tasks. This will then provide a basis for targeted ergonomic interventions and provides a starting point. So in order for us to answer the question that was on the previous slide, that takes us to our current study. So I designed and distributed a survey that was targeted at PSWs and had the objective of identifying the most physically demanding and frequently completed PSW tasks. As well, we wanted to identify crucial contextual factors that can influence the physical demand requirements of PSW work tasks. And what contextual factors are there are factors that can influence how PSWs complete tasks and can change how the task may affect the PSW. So for example, things like client weight or a cluttered and confined environment. Once we've identified the critical PSW tasks, we formed a work circuit that incorporates those tasks and packages everything together. And this serves as a usable circuit that can be done within a lab environment and with participants in order to collect biophysical data. Then with the creation of the work circuit and the subsequent collected data, this can provide the basis for the development of ergonomic interventions, such as physical employment tests or education programs, or the design of a real-time workload management system. So several steps and considerations were made in the design and development of the survey. I referenced the most recent physical demands description for PSWs as assessed and provided by a national care provider who employs PSWs across Canada. Then to further develop the survey, focus group sessions were conducted with active PSWs who were working with the aforementioned care provider. And once the survey was finalized, it was distributed to around 5,500 PSWs across Canada, and overall, we received 443 complete responses, which was sufficient for our ideal sample size. The final survey consisted of 3 different sections. So section 1, which gathered employment information and demographics. Section 2 of the survey was where we had respondents rate the physicality of tasks within each of the listed task sections using a 5-point Likert scale, which you can see on the right side, where 1 is very easy, meaning little to no physical demand is required to complete a task, and 5 is very hard, meaning the task is extremely physically demanding. As well, participants had an option to choose NA or not applicable if they didn't do the task at all. Additionally, in section 2, the survey asked respondents to pick the factor out of the ones listed that increases the physical demand the most for a specified task type. So for example, for section 2B of the survey, which focuses on client transfers, the respondents would pick one of the listed factors, so heavy client, client with limited mobility, absence of an assistive device, and a one-person transfer, and pick which one of those factors would increase the physical demand the most for the task of helping a client with moving from one place to another. So this is that contextual factor piece. Then in the last section, section 3, it contained 2 open-ended questions that asked the participants to list their top 3 most physically demanding and frequently completed tasks. So diving into how we analyzed these results, for section 1 of the survey, with the employment information demographics, counts and response percentages were performed. Then for section 2 of the survey, where respondents rated the physical demand required of the specified task types, descriptive statistics including frequency counts and mean ratings were calculated. As well, the most physically demanding PSW tasks were determined if they had both a top ranking mean rating and if there was a response rate of over 75%, ensuring that that task was frequently completed by PSWs. As well, in section 2 of the survey, we did ask the participants to rank which stated contextual factor increased the physical demand the most for each task type. And frequency counts were performed, and we ranked the top contextual factors for each task type. Then for section 3 of the survey, with the 2 open-ended questions, all of the answers were analyzed and coded into themes in terms of mentioned task types and mentioned contextual factors. Now, getting into some of the results, just to quickly summarize section 1, respondents were predominantly female, anywhere between the ages of 36 and 55 mainly. Most of them worked full-time and were either located in Alberta or Ontario and had between 0 to 9 years of experience working as a PSW. Now, although we did distribute the survey to PSWs across several provinces in Canada, most of our responses did come from Alberta and Ontario, and this may be due to just a numbers issue. We spoke with the care provider, and they did tell us that this is just where most of the PSWs they employed were located. And this might be an issue regarding online communication and distribution of the survey. So just maybe in some of the other provinces, they just had limited access to their email or just didn't check it as often. So from section 2 of the survey, where again, PSWs were asked to rate the physical demand of the tasks that we listed from 1 to 5, this chart showcases the top 12 most physically demanding tasks. And subsequently, we can see some certain themes popping up within these tasks, which are boxed in red. So most of the top ranked tasks in terms of physical demand involve some aspect of, a client transfer or a repositioning task. And more specifically, the top 6 tasks all involve the transfer of a client who requires a wheelchair. So whether that is a transfer where the initial point is the wheelchair, or if the wheelchair is the final destination. And an interesting task that actually ranked fairly high in terms of physical demand was the specific task of putting on and taking off compression socks, which ranked 11th. And I think that that's pretty interesting since, it's competing with, I guess more usually suspected to be physically demanding tasks such as repositioning tasks. Now in this table, we also have the mean scores displayed, again, where 1 means that the task is very easy and 5 meaning the task is very hard. And as you can see that most of the mean scores range from around 2 to a 3, which represents easy to somewhat hard. Now, the reason why we might be seeing these slightly lower scores is that in this section of the survey, we did ask participants to rank the physical demand for the listed task, but we specified for the respondents to imagine that they are doing the task with a baseline client. So a client that is of average weight, of average height, is, has most of their mobility. So although these tasks might be thought of as a little easier with a baseline or quote unquote normal client, the responses regarding the contextual factors, which are mentioned later in the survey, might give us more insight into the more realistic physical demands required of these tasks. Now, pulling from section 3 of the survey, where participants were asked to state their top 3 most physically demanding tasks, this chart showcases the top ranked task themes that were presented in the answers according to the times that they were mentioned. And we can see that the results from section 3 were agreeable with what was found in section 2. And I highlighted the tasks that were previously deemed to be the most physically demanding. So you can definitely see some similarities there where the top ranking task theme was anything to do with client transfers and manipulations. And ranked 4th was, again, any wheelchair or walker related tasks. Now on this slide, I listed the top identified contextual factors that were deemed by participants to increase the physical demand of a task type the most in section 2 of the survey. And as you can see, the top 3 contextual factors mentioned were heavy client, client with limited mobility, and a cramped environment. And I highlighted in this table the task types that were identified earlier to be the most physically demanding. So transfer tasks, repositioning tasks, and dressing tasks. So I wanted to see with these top ranking physically demanding tasks, what specific contextual factor affected those specific tasks. And you can see that heavy client or a high client weight was deemed to be the contextual factor that would increase the physical demand of those tasks the most. And I guess as more of an outlier answer, in terms of a task of helping a client with dressing, the top contextual factor was actually mobility. So a client with limited mobility would affect that task the most. Now, something that might be of interest to people who are interested in, 1 versus 2-person transfers or just 2-person transfers in general, we did provide the factor of completing a task type by themselves versus with another person as an option for when they chose the contextual factor that would increase the physical demand of a task the most. So for patient transfers, the contextual factor of 1 versus 2-person assistance actually ranked below client weight and client mobility. And a possible reason for this may be that having another personal support worker or PSW assist might just not ever be an option a lot of the time for PSWs, especially those that are working within client residences, since most of the time they are working by themselves. So respondents might not even see this as a factor, since it's just the baseline for them anyways, it's just working by themselves. Now, in addition to task themes, the contextual themes mentioned during section 3 of the survey were also examined. And the most mentioned contextual factors were high client weight, followed by low mobility or a high fall risk client, which are very similar to what we saw before in section 2 of the survey. And the third ranking contextual theme was actually having a difficult client, which is sort of like an umbrella term for, a client that could be aggressive or has low motivation, or perhaps there's a language barrier present. And again, these results do agree with what was found in section 2 of the survey. Now, moving on to what we found in terms of what were the most frequently completed tasks. We examined what was answered in section 3 of the survey. So the top 3 most frequently completed task themes were tasks completed in the washroom, followed by assisting with a client care plan, and third of all, dressing the client. And I know those themes are fairly broad, so I did want to take a deeper look into what specific tasks were done the most frequently. So for the top most frequently done tasks, it was specifically the task of showering and bathing a client, followed by medication assistance, and third of all, assisting clients with donning on compression socks. So if you remember from previously on a prior slide, I did mention that this task of donning on compression socks was actually deemed to be physically demanding, and very much so, and being a high-ranking task. And now that we see that it's actually also one of the most frequently completed tasks. Now, to shape the following discussion to come, the results of this survey was used to create a work circuit reflective of common and physically demanding PSW work tasks. And this in turn can form the basis for ergonomic interventions such as the physical employment test or the workload management system. And I'll be speaking in further details about these possible ergonomic interventions a little closer to the end of this presentation, but I just wanted to sort of re-highlight the goal we had with the survey. So with the aim to create a simulated work circuit containing tasks identified by the survey, here are the tasks that we want to incorporate. Number one, transfer tasks involving a wheelchair and transfers within the washroom. We also wanted to include repositioning tasks with the client in a bed. We wanted to include having the PSW assist a client with putting on compression socks. And last of all, a washing task, so showering or bathing the client. As mentioned before, we must consider the influence of contextual factors on the physical demand of tasks. So the circuit that we design needs to incorporate a client that has these contextual factors that we found with the survey. So they must be, we must include things like high client weight or have an actor or a patient that has limited mobility. And with that said, we came up with this proposed circuit design. And I guess to sort of briefly run through it, it starts off with the patient or a client in bed, and we would have the PSW transfer them to a wheelchair before maneuvering them into a washroom and performing a toileting task, a bathing task, and then having them transfer back onto the wheelchair, wheeled back into the bedroom, perform a dressing task, and then ending off with some repositioning tasks in the bed. And again, with the circuit, that will help with the development of the earlier mentioned ergonomics interventions. I will go into this a little later into the presentation and how this applies. Now, overall, the tasks that our survey identified to be the most physically demanding mostly align with what we have seen stated previously in research, with patient transfers and patient manipulation ranking high. However, a large amount of patient handling research is focused around their nursing occupation, and although we can reference these studies, due to some similarities between the tasks done by them and PSWs, there are some certain nuances. So just a couple of differences between nurses and PSWs and their work that they do is the fact that PSWs are unregulated. And what that means is that since they don't have a lot of regulation, they can actually work or do a multitude of different tasks. So they can perform a large range of various tasks. As well, many PSWs work in client residences and in home care, which can really exacerbate a lot of the contextual factors that influence physical demand of their work tasks. So although we can conclude that contextual factors such as high client weight or working in confined work environments can span across both occupations for nurses and PSWs, PSWs might be more affected by these factors. So for things like not having as many assistive devices provided to them and working again in client residences where it's an unregulated space, these might further exacerbate the exposures that PSWs experience. And last of all, PSWs do tend to do more manual labor or things that involve a lot of lifts and transfers in comparison to nurses, as they're not doing as much medical related or admin tasks as nurses. So to summarize, all of these differences can, again, exacerbate the physical demand requirements for PSWs. Now, when it comes to 1 versus 2 person transfers in the context of PSWs and home care, so through our survey, we found that client weight and mobility level were the most important contextual factors that increase the physical demand for PSWs. And perhaps 2 person assistance could help alleviate these demands. However, although 2 person transfers or 2 person assistance, might be an option to decrease physical demands on PSWs within a facility environment, What about in home care? So there are some issues we can run into, such as just the number of PSWs available. So although PSWs are a growing worker population and there is a high demand for them, there is still quite of a mismatch between, the number of PSWs we have and the amount of care that we need for them to provide. So numbers might be a big issue when it comes to trying to do two-person transfers or two-person assistance. As well, it might be very difficult to actually schedule two PSWs to go to a client home who have the same schedules and are free at the same time and are located closely to that client. And during the focus groups that I had with PSWs, they indicated that sometimes the client would be flagged as needing two PSWs to care for them, but a lot of times PSWs would still just be going to handle those clients by themselves. So with these issues, it might actually point at the need for, some other routes that we might need to go down towards. So things like an improved scheduling system, or perhaps maybe we need to focus more on the provision of assistive devices. So if having two personal support workers go in is not an option, at least we can provide, assistive devices to decrease the burden that's placed on that single PSW. Now, what I think is the most important finding with this survey and the results that we received is the emphasis and the importance of contextual factors and their effect on physical demand. And more specifically, my survey provides insight into specific contextual factors that affect specific tasks. And that will help with providing direction to what ergonomic interventions can target. And as previously mentioned in section 2 of the survey, respondents were asked to rate the physical demand of tasks in a best case scenario, where the contextual factors present are quote unquote normal. And this produced lower than expected physical demand scores. However, in section 3, where we had those open-ended questions, many of the PSW's responses actually included contextual factors unprompted when stating their most physically demanding tasks. So for example, we would have PSWs say, the hardest task for me to do is doing a transfer from a bed to a wheelchair with a patient that is 300 pounds, 6'4", has limited to no mobility. So they would actually answer that unprompted. And I think this really emphasizes the importance of contextual factors and how it strongly influences physical demand. As well, although our survey actually identified the task of donning on compression socks to be a very physically demanding and frequently completed task, there is little to no research really done in this realm in any attempt to quantify the exposures of this task that it imposes onto PSWs, and little research really done in regards to the available compression sock aids. So this could be an interesting area of research that we could go down towards. Now, with this initial work circuit design, there will need to be a little more work done on our part to finalize the work circuit. But once the work circuit is completed, we'd want to recruit PSWs to come in lab and complete the work circuit so we could collect some biophysical data such as kinematics or kinetic measurements or physical exertion measurements. And with that work circuit and the data collected, there are a couple future avenues that we can go down that would help us keep PSWs safe and reduce and mitigate injuries. So going in order of some possible shorter term goals to some bigger picture goals, we can first start with creating a physical employment test using the work circuit that was designed as a basis in PSW recruitment. So potential PSW candidates would be required to complete this work circuit containing some of the most physically demanding and hardest PSW tasks to see if their physical capabilities match with the physical requirements of the job. And if there is some mismatch, perhaps we can target those areas with some training. And again, as our study emphasized the importance of contextual factors and how they influence physical demand, this identifies areas where in our PSW education programs that we can focus on or change. So with better knowledge on what PSWs actually do in the workplace and what tasks may present higher injury risk towards them, it could help us focus in on those tasks that require additional training to ensure PSWs learn how to actually complete those high risk tasks safely. So, for example, with training, maybe we need to include clients or patients that have varying characteristics, such as weight, right? So, working with heavier patients. Or maybe this really promotes that we need to shift from less of a classroom-based training environment to more of an on-site training environment where all of those contextual factors are present. As well, the work circuit that we design can serve as a potential training course. Last of all, and definitely the most long-term goal would be to design a workload management system that would be able to actively monitor PSW workload in order to decrease injury and overworking while promoting work efficiency. And this is where my thesis will be focused on, which will look at the use of smart technologies such as smartwatches and how we can use that wearable data to predict cumulative spinal loading and damage. And this pathway focuses more on a proactive management of exposures and targets an area that PSWs frequently get injured in, which is their low back. And just to conclude, again, the results of this study provides the rankings and ratings of the physical demand of the required of a wide range of PSW tasks, along with providing a quantifiable score. In addition, although prior studies have identified important contextual factors that can increase overall physical effort required by PSWs to complete their work, none have mapped specific contextual factors to specific PSW tasks. And overall, the results provided forms a basis for more targeted ergonomic interventions. And I am excited to be working towards research that supports the creation of a workload management system in the next year. And that is my presentation. Thank you.
Thank you so much, Daphne.
Thank you.
We'll encourage participants to start typing their questions into the chat. And while we're waiting, I'll just make a couple of comments. One of the things that strikes me right away is because the data came from one healthcare provincial provider, it would be really interesting to see when comparing this data perhaps to another provincial healthcare provider if the results were really similar. Because as we know, individual providers, just like individual education programs, have different onboarding training for PSWs. And so the impact of the training that is provided to PSWs may show up in the data.
Absolutely. I think I totally agree that it would definitely be interesting to compare these results either with another provider or another subset of PSWs. And I think that that can be difficult due to the fact that PSWs are largely unregulated. So even to be able to contact or get someone else on board would be a little difficult, but it would definitely be very interesting. I agree.
Might be something for a
Yes.
seed grant for another large provider to work with
Yes.
a CRE-MSD researcher.
Mm.
So, yes, we will get a copy. I just saw a few questions coming in. This presentation will be made available. It will go up on our CRE-MSD website. And so people will get to see the references, but I will ask Daphne to put that reference slide up now.
Yep. I can just,
And
I'll just keep it on first.
So we have a question here, and I recognize the name from another life. Karen Bentham. Given the challenge employers have finding PSWs, um, won't the approach of matching workers up with demands of the job make recruitment even more problematic? What is your perception of that, Daphne, and then Steve, and myself, and may
Yep,
have other comments as well.
absolutely. I can sort of give my first opinion on this, but
Okay.
absolutely, I think when it comes to physical employment testing, I think that's also an area where I was like, if we need more PSWs, won't having this test sort of deter, um, you know, possible PSW candidates to, even apply, or maybe they think that they can't, pass it. Um, but I like to think of, having this test, I guess, less like a test, but a way for us to gauge, again, their capabilities and what the job actually requires, and show us areas where maybe we need to target additional training to, whether that's physical training or, an educational form of training. So maybe less thinking about it like a test, but gives us a way to discover where, certain areas we might need to work on, to prevent injuries down the line. But that's sort of my thinking. And if anyone else, Steve or Catherine, wants to comment, feel free.
And Daphne, I think your comment on prevention of injuries. So for PSWs entering the field, there is some reassurance that the employer really is concerned about preventing injury, and therefore they're looking at their abilities. And based on that, it is a way to promote what they have to offer, as well as the training that they've put in place. So it
Hmm.
may not be negative at all.
Hmm.
Let's see what else we have here. People who seem to be very happy with the fact that we're looking at contextual factors. Um, and let's see down here. Um, I have experience in the past having an OT provide some training on a Hoyer lift for some PSWs. We were told by the OT that they do not have much training on lift aids. Um, that certainly has come across in the education that is out there for PSWs. And Daphne, I'm not sure if you had any information in your survey around exposure to lift aids and training related to lift aids and
Yeah, for sure.
PSWs.
Let me, sorry, I'm just gonna be going back to a results slide here. There we go. So definitely, we did add the tasks of, using a Hoyer floor lift or any mechanical lift. You can see, I think right there, ranking 10, we had, using a Hoyer floor lift to move a client from one place to another. And this did end up ranking fairly high, so within the top 10. And although we didn't mention too much specifically about using um, assistive devices, is because we wanted to target the most physically demanding tasks. So I guess we sort of went in with an assumption that using a Hoyer lift is a little easier than doing a manual lift. But I think it comes down to, especially with PSWs in home care, just not having access to these devices. Maybe that's a factor when it comes into training, is because, I mean, if we're not using them as often, why would we need training? But perhaps there's been a push for more assistive devices, and now there's a almost like a disconnect between what is actually being done versus what they're being trained on.
Right.
But yeah, again, Catherine,
Thank you.
I'm sure you have a lot of knowledge in this field as well.
I think you're absolutely right. There is a huge challenge in the healthcare field related to any devices, specialized beds, Hoyer lifts, um, and with more people being cared for in the community, including bariatric clients, it may be something that we will see more of in future.
And
Um,
Catherine, just if I could
Steve, go
extend,
ahead. Yes.
Yeah, just to extend on that a little bit on the training piece, one of the things that's come up with our provider partner is how much the data has helped them reconsider what they are doing from training, not just with the fire lift, but more broadly. So
Mhm.
these results have almost served as a formative step in helping them to audit, where are we training and doing well, and where, based on the results, where do we maybe need to brush up on some of that training now that we have a little better understanding of what our folks are doing out there.
That's a really great comment, Steve. And the the community of practice for client patient handling at CRE-MSD had a seed grant to a few years ago where they in fact developed an evaluation of mobility and handling training for PSWs, um, and it is actually a template for the ideal training components. It doesn't give all the certainly address all the content, but it certainly addresses the key components that should be put in place. So your research has certainly reinforced all of the components, the training components that were listed in this document. And I would encourage anyone on today's call to have a look at that evaluation of mobility and handling training for personal support workers. And we can attach a link to that document. Let's have a look at what else we have here. Um, One of the questions is about curiosity related to training and how it can be used as a risk mitigation strategy when the exposure is related to high forces and high frequency. For example, how would training effectively reduce, and I've lost the
Oh,
question here somehow.
mhm.
Bettina, do you see it?
I can read it. I think I have it.
Okay, do you see it?
Yeah, I
Okay,
think it
perfect.
was yeah, so
Oh, I
when
see it. Reduce the risk of manually transferring a 300-pound low mobility client from a bed to a wheelchair.
Mhm. Um, so I think when it comes to a situation sort of like the example you gave where you're already sort of setting the scene, you have to do a manual transfer, the client's 300 pounds, they have low mobility. Um, in terms of training, honestly, from my point of view, that if that's sort of the scene that's set, I'm not sure if you could really um, exactly target that with things like trading, because it's going to be hard. Not, I don't think there's too much you can do um, with training in that situation, but I guess it would be more so we know that this is a bad situation, and perhaps we need additional training with the addition with a provision of devices. So I guess in terms of that's sort of where I was going with that piece with one versus two-person transfer. Um, there might need to be a push for provision and education around assistive devices, at least within the PSW population, as a better option.
I think you're right, Daphne. I don't know if you have anything to add to that, Steve.
Yeah, just one note, and this is actually, just ironically, just prior to this presentation, just reading some um, research that's coming out of the paramedic space. And a lot of what those findings are suggesting is training can be really important in helping to inform the decision-making process that goes into performing, say, a patient handling task. So it's actually stepping back from just the
Mhm.
action of doing the lifting, but thinking about, what is the space around you? Can you move a light object to create more space, more room for you to move? Can you align some of the assistive devices a little bit easier so that the lift actions can be as efficient and effective as possible. So I think there's lots of opportunities in that regard to think about the decision making that goes into preparing to do the heavy demanding task, in addition to thinking about how you actually execute it.
Steve, thanks for that comment. And something that this community of practice is actually working on is a decision tree in order to actually step back and say, can a two-person transfer actually become a one-person transfer? And all of those really important questions, assessments, all of the things that should go on before are really critical to look at previous to training as well. So really, really great comment. People were really happy to get this information and very interested in just hearing a little bit more about this workload management system. So maybe both you and Daphne, Steve, can comment on this.
Yeah, absolutely. So with the workload management system, so I think I mentioned in the presentation, but that is where my thesis will be focused on, is towards working towards a workload management system. So I guess to give a little more background on my thesis and what I'm planning to do is, again, using wearable tech, so something like a smartwatch that is non-obtrusive, it has sort of it's easier to incorporate in the workforce, such as with PSWs, and use the data that we can collect from those smartwatches and see if we can build or sense a relationship between that data and internal loads. So things like cumulative spine loading or damage. And if we can sort of establish a relationship, then we're almost able to better understand the exposures experienced by PSWs cumulatively. So when they're working throughout, their shift, doing several different tasks in a row, we can actually be able to measure in real time what their experience loads are. So that's definitely going to take a lot of work in the next following year, and then even that in itself is only just the first part towards is actually designing a complete, established workload management system within the PSW workforce. But I guess that's why I sort of labeled it as definitely a long-term goal. There's a couple other things we could do in the meantime, but yeah,
Thank you.
that's a little bit about that.
Thank you. Anything else to add on that, Steve?
Yeah, I think, big picture, and I'd love to hear feedback from folks in the call, and you're welcome to email myself or Daphne. But, thinking for those that follow a lot of sports or athletics, this has become pretty commonplace in the athletic realm where technologies are emerging that can help coaches, trainers, support teams monitor the both the physical intensity of the loads being imposed on the athletes, but also how they're recovering and allowing them to perform optimally. Now, I'm not suggesting that we need to take all of our PSWs and turn them into Olympians, but the same concept, I think, can apply, especially for what I'm going to call our occupational athletes, whether it's first responders, PSWs, nurses, folks that are doing physically demanding work. So can we borrow some of these concepts? And in some cases, we'll have to obviously make some nuanced changes, but get a little bit better about how we organize work, how we support our workers in terms of not only what we expose them to, but what opportunities we give them for recovery. I'm not going to use the word rest, but recovery. So it might tie into a broader kind of health and safety strategy around how we support both reduce demands, but also support wellness initiatives to make sure that our folks can maintain the integrity of their tissues, so to speak, maintain their capacity, resilience to complete these physically demanding tasks day in and day out.
It's very, very, very exciting. Thank you for that comment, Steve. And just even the demographics. So there has been a shift, certainly in the last decade, from a younger, your data suggests as well, more of a younger age range than a decade ago. Um, and we certainly have research related to our own aging and the impact that has on our muscles and our performance. So exciting opportunities ahead.
Mm-hmm.
We have a question related to what is out there related to physical employment tests. Did did you see in your literature search many other physical employment tests for this role or other roles?
Yeah, I'm wondering, I know obviously Steve does a lot of research into this. Did you want to comment on that first or?
Yeah, so at least based on what I've seen in the research, not a lot of evidence regarding physical employment standards specifically for the PSW or healthcare aid profession. So I think that's something we're hoping to this study is a first step to kind of poke down that route. Our lab has been fairly extensively involved in developing these types of tests in what I will call related professions, paramedicine, some collaborative work with the military and so on. So um, the process has actually been quite well established, and uh, Canada is well known as a leader, in part based on the Mayoran decision, which was back in the early 2000s. So we're excited to have lots of great folks at the institution and more broadly in Canada as we help to push this initiative forward.
Thanks so much, Steve. I'm not sure whether or not this research-based presentation can answer this question, but I'll put it out there. What kind of assisted devices are available for turning a client in a bed? You mentioned that as one of the most physically demanding tasks.
Mhm. At least I definitely know with things like, for example, a slider sheet
Mhm.
has been used before to obviously help, shift clients, but also to turn clients as well. I'm trying to think if there's anything more recently that was made, but I'm actually not too sure. Maybe Catherine, have you seen anything pop up more recently?
Nothing more than the transfer boards and slider sheets. There are some controversial things that are used in different ways, such as tying of bed sheets around the waist of
Hmm.
a client. With the lack of assisted devices, providers have been creative, um, not all, often to the detriment of the client and of the worker. Um, so that might be something for us to look at for another day. Steve, I'm not sure if you have anything to add, especially from your experience with paramedics.
Yeah, I think the landscape is changing. So my advice is just to try to carve out a little bit of time every so often to check in because a lot of our work, and we've had the opportunity to work directly with some of the manufacturers of different types of assistive products. So there's lots of development work going on, but quite frankly, the evolution of technology and capabilities is expanding quite quickly. So just kind of recommend keeping an eye on things. Um, but the folks that design these project products are well aware of the challenges and desperately trying to solve them. And I think they're also really looking for input from folks like all of us on the call, and particularly PSWs, so that the solutions do hit the mark. So reach out to companies that make these products, give them your insight, give them that little extra nudge to help them continue to develop effective and efficacious solutions.
Wonderful. Thank you, Steve. We have time for one more question, and then those questions that haven't been able to be addressed, um, we will certainly look at them within CRE-MSD. And if there's anything we can look at in terms of getting a webinar or a workshop or conversation group around any of these questions within the community of practice, we will look at that. So last question, will your future work, Daphne, involve the role of the client's contractual agreement, if any, on the equipment and space requirements to support different levels of client needs? Is this something that you've considered?
So from my understanding of this question is basically um, with the care provider that we are sort of working with, like, are we planning on like helping them with decisions with equipment or things like that? I don't know if I'm
Yes.
going down the right route, but
Yes.
that could definitely be a part of my future work again, with my thesis, it's like it's working down that workload management system, but definitely on the side, there's several other things we can do in terms of mini projects and other sort of excursions, I'll say. So definitely looking into, equipment and what sorts of equipment are more beneficial for, PSWs within this company, and based off of our study results and what we've seen, especially once we get PSWs actually into the lab and completing our work circuit, we'll definitely have a lot of data to work with to inform some of these decisions. Yeah, so I would say absolutely, yeah.
Thank you so much. So we definitely will come back to discussions, webinars related to client-patient handling. This was just an excellent way to kick off a small hiatus that we've had in the community of practice. I want to thank you, Daphne, so much for sharing this with us. This was just great. All kinds of questions that we didn't get to. Lots of engagement here. And thank you, Steve, for all of your support. And I encourage everyone to watch the CRE-MSD website. We will be posting on our events page an upcoming webinar on exploring the efficacy of portable lift assist devices relative to large mechanical lifts to lift fallen residents. So more coming our way. And again, thank you so much. Wonderful engagement today. We look forward to talking to you again in future. Have a great rest of the day.
Thank you.